Nurses and doctors of Reddit, what is your they never taught this in school moment? Story 1 took care of a young man with a gunshot wound to the abdomen. He had many complications. He was in the hospital for over a year. He had an ostomy bag for a while, but when they finally removed it, he was so nervous because he hadn't pooped in so long. His call light goes off, and he says, "Go look in the toilet." You're never going to believe this. I go in there, and there's in the toilet. His first solid I'd seen in over a year. I walked out and gave him the biggest hug. He was so proud of I walked out of his room with tears in my eyes. Nursing school never prepared me for crying outside of a patient's room because I was so happy they had pooped. Edit, thank you kind strangers for all the silver and gold. It warms my heart to know this comment made you smile and was relatable to some of you. Good luck to those who are on their own ostomy journey. It stinks literally, but always keep hope. And always remember it's the little things, a grateful PEDS nurse. Story 2, how to sit in bed and hold your patient as she profusely vomits and delivers her 16-week-old dead fetus. Yes, they teach you that compassion and empathy are the backbone of nursing, but absolutely nothing can prepare you for this type of situation. Edit, holy moly, I just woke up and was so confused why I had 30 notifications, which turned to pure AWE when I saw the upvotes and the silver, gold, and platinum. Thank you, kind people of Reddit, but more importantly, thank you all for your support and for sharing your stories with one another. I think it can be beneficial and even liberating to talk about something as difficult as losing a baby, and I'm glad that this comment opened up a door and allowed some of you to talk about it. You guys are most certainly not alone or forgotten about. I wish you guys nothing but the best in the future, and you may most certainly PM me if you'd like to talk separately. Story 3, how to put a fake eye back in. A patient came in from a not-so-nice nursing home with a multitude of problems, one of which was a disgusting, draining fake eye that had to be removed for treatment. Upon discharge, we had to put it back in. Simple enough, we thought, but we had no idea how and struggled to figure it out. I suppose that is why the nursing home staff never took it out to clean it. This was decades ago. Fake eye technology is probably much better today. Story 4, this one was fun. Patient in ER gets a standard urine drug screen. Positive for ethanol alcohol. Patient insists he does not drink alcohol. Test is repeated. Positive. Patient is very upset. He does not drink alcohol. Blood test is drawn. It's negative. We checked everything we could think of. Did we have the right urine, the right blood? It should be impossible to test positive on urine and negative on blood. Meanwhile, I finish his regular urinalysis, high white blood cell count, and really high glucose. Elevated white cells means you need to look at it under the microscope because they probably have an infection. It's loaded with yeast. The man was diabetic, obviously, and had high glucose sugar in his urine, along with a yeast infection of the bladder. The yeast was fermenting the glucose to ethanol within his bladder. He was the man who peed beer. Story 5, nurse here. They never taught me to cover up someone's, but with a bed pad, as you give an enema, can sometimes explode out while you hold the tube in place. The first time I ever gave one, my whole arm was covered in by the time it was over. EDIT, thanks for the gold. My mom was fresh out of nursing school in the 80s. She got a job at a hospital that had a high concentration of geriatric patients. One particularly frail man took out his dentures before sleeping, then passed away in the night during her shift. His cheeks were so alarmingly sunken in. My mom and another nurse tried to put them back in so as not to horrify the family. However, rigor mortis had already started to set in. She said nursing school definitely didn't prep her for that nightmare. Story 6, I was in my first year out of family practice residency. The specialists like to sneeringly refer to us as Jack of all trades, master of none. I was on call from the ER. A normally unshakable ER doc was beside himself, had a very preterm mom in active labor, and Fog wouldn't let us fly her out. He was the only ER doc, and the transferring facility wouldn't take her in transport without a physician on board, probably not legal, but we needed her to be at a hospital with a NICU and LD, so they called me. En route, I was trying to coach her to breath through the contractions, but she felt something coming out. I looked and saw a foot. So we're in the back of an ambulance delivering a footling breech preemie. We delivered about a minute or two out of the hospital. They were expecting a mom in preterm labor, not a micro preemie. We were met in the ambulance bay by one nurse. She took a look at me holding the baby with a blanket and oxygen and said, "Follow me." We ran through the hospital to LD and turned on an incubator. PEDS wasn't in house and the baby's heart rate was low. So I proceeded to intubate her. That was 12 years ago. She survived and is doing great. I wrote my program director at 4 a.m. that morning when I got back home, thanking him for all the training. I think I used 100 of my training that night. Story 7, how to react when a patient's bowels pop out of their incision. This happened when I was a brand new nurse, but off orientation. Quite a learning experience, but came in handy because a few years later, it happened to a different patient, and I knew what to do. You have to keep the bowels very moist, cover with sterile gauze, and patient is rushed to the edit. I'm glad this was taught to some of you in school. I remember learning about it, but never learning what to do if it happened to a patient. Story 8, student nurse here. How to hide looks of shock when something very surprising or awkward occurs. I remember one time a doctor grabbed me when I was in the hall to hold something for him while he was putting a patient's prolapsed rectum back in. Awkward. Story 9, nearing completion of an air contrast barium enema on an extremely elderly patient. Out of nowhere, she starts saying, "Call Rochester Funeral Home." I'm dead, call Rochester Funeral Home, and dead. She repeated it no less than 10 times. Story 10, when I was a student, I accidentally degloved a patient from the elbow down. They were incredibly sick, probably already brain dead, and had one of the worst cases of TN toxic epidermal necrolysis I've ever seen. Anyway, I'm in there holding this lady's inside-out arm skin like an idiot with the family standing in the corner horrified, and I just froze. My first thought was to kind of slide it back on, but thankfully one of the senior nurses rescued me and snipped that off. Story 11, the first time I had to tell someone their loved one didn't make it. Though they address it, no one really tells you how to break bad news to someone, how shitty and impotent you'll feel doing it. The fact that you won't be able to answer their panic questions, what it's like to realize that there's nothing you can say to family members that will truly bring comfort, how shocked or even angry you'll be when some people don't really care about mom going downhill. How ashamed you might feel when you look back and realize that you're becoming numb to it all after a while. Yeah, you probably had to click through some presentation on the 5 stages of grief at some point and maybe a generic lecture on what not to say, but until you've stumbled through it a few times, you're winging it, and probably poorly. Story 12, nurse here. A very panicked nursing assistant came running to the desk one day, saying, "You have to come see this. I don't know what this is." The NA brought me into a patient's room where she was giving a bath and points to an area on the patient's buttocks. "What is that?" I lean in for a closer inspection when the patient starts to turn back around and says, "I asked that my eye." Sure enough, I didn't receive and report that my patient had a prosthetic eye, which at some point came out of the socket and became suction cupped to her buttock. I left the room and had never laughed so hard in my life. Story 13, from former boss. How someone looks at you when he tests positive for HIV after his wife died of AIDS because you were her doctor and you treated her for years. You were also his doctor. You knew she hadn't told him, and you knew that she was still having unprotected with him. Story 14, respiratory therapist here. How to act when we unplug the ventilator to let go a patient, especially when the family is around. To their defense, they do warn us it's going to happen, but it's never until you actually do it that you realize the weight. I like to talk to my patients even if most are already brain dead at this point, although I did have to unplug conscious patients. That was hardcore, to say the least. This gives me a sense that at least if even a small part of their consciousness is still alive at this point, they know they're not alone. I tell myself that at least from now on they won't be suffering anymore. Story 15, wow. So many things. I think one important thing that was never taught is how to deal with a patient dying for the first time. I couldn't stop picturing his last breaths, the yelling of his family, all of it played through over and over. Hospice is tough, but it still is one of my favorite jobs I've ever done. Story 16, all those things you encourage your patients to do: eat well, exercise, get enough sleep, etc. also apply to you. I know too many nurses who don't take care of themselves mentally, physically, or emotionally in a very draining environment. Self-care is incredibly important, and sometimes we'll lose sight of ourselves and try to take care of others. But we're of no use to anyone if we're running ourselves ragged. Edit first. Thanks for my first gold stranger. I didn't expect that at all, especially on a comment about how we're not taking care of ourselves. And second, please, please, please try to take care of yourselves. I know it's hard. I know we've all seen some and have all probably had nightmares from it, so it's probably not high on our list of priorities to make sure we're okay. But you're no good to yourself, your loved ones, or your patients if you don't. If anyone ever needs to just vent about anything, please feel free to just message me. Story 17. Women will pee and during labor, ribs crack during CPR, and it feels really weird. There's a market for amoxicillin amongst 4 drug users. According to my patients, it's very common for somebody else to put cocaine in their urine, and fentanyl is a transmitted drug. Story 18, on behalf of my husband. No one tells you how many low-income women will go to the ER, complain of abdominal pain, go through an exam, and have different tests ordered because they can't afford a home pregnancy test. Story 19, so many things. Hey, race what I can think of off the top of my head. 1. Sugar is used to put someone's prolapsed rectum back in. Sprinkle it on and let it sit, drawing some of the liquid out of the tissues of the rectum and just kind of push it back in. That was fun on the job training. 2. How to put someone into a body bag with dignity, especially if they're tall and or in an awkward position. 3. Fournier's gangrene. One day, I was actually precepting a patient care tech while I was a nurse in the ER and had a patient ask me to help him dress his wound. This was not why he was in the hospital. Thinking this would be a great teaching moment, I called my tech in to learn how to do some wound care. She learned that day how to maintain an excellent poker face for never block your own exit out of a room with an actively psychotic patient. 5. How to comfort an inconsolable baby using a combination of low shushing in their ear, a somewhat aggressive swaying motion, and some humming. 6. How to interact with patients and their family members on sometimes the worst days of their life. How to hold someone's hand when they've just gotten terrible news about their own or their loved one's prognosis. How to celebrate the often few and far between wonderful news we get to tell patients. And then how to leave that room where you may have just told a family their loved one is dead. Collect yourself and go into another room with another patient and care for them like it's just another day. Nursing is a profession where you have the sacred honor and ability to be there for people on the best and worst days of their life. To be able to hold a life that is merely seconds old and hold the hand of someone during their last seconds on earth. That's not something that you can be taught in school. Story 20R doc here. Sorry to intrude. They teach you how to handle death. They tell you you're going to have dead patients. You're going to see the ugly side of death that doctors and nurses don't have to see, because when they get the patient, most of the ugly is handled by you. So we need thick skin. But when you have to hold the hand of a kid less than 10 years old who says, "I don't want to die," and next watch him slide into a no waking up sleep, it's life-changing. I didn't want to cry tonight. Enough Reddit for today. Per my GF walking into a patient's house home health and almost being knocked unconscious by the smell of cat. The lady housed 25 feral cats, but didn't let them outside because she was afraid the coyotes would eat them. Walked into a trailer house, connected to a camper, only to see the floors start moving. Realized it was cockroaches, not the actual floor. Story 21. They never really tell you how to cope with being berated by family members, patients, and even co-workers. Part of being a nurse means that you realize you are dealing with people at their most vulnerable at the worst time in their lives, and you know this in the back of your head. But being an emotional and sometimes physical punching bag for days at a time requires a certain mental toughness that you can never really prepare for. Story 22. Not a doctor or a nurse, but I was a combat medic in the Army. So, after basic in my job schooling, I show up to my first duty assignment. Now, as a fresh little private, you expect more of your job being oriented towards combat medicine. Hence the job title. That's where I got my first taste of "don't get your hopes up" in the Army. So know there am told I'm pulling medical coverage for a 15-mile ruck march. Here, I'm thinking one. People really walk 15 miles too. WTF is med coverage. 3. I don't even have an aid bag. How do I treat people? I get the typical NCO response figured out. So basically I'm scrounging around finding the friendliest faces in my medic platoon. And mind you, most of this platoon got back from Afghanistan a few months prior, and all these guys treated live combat casualties. So this meant no friendly faces. When you're the new private, you were underneath the bottom of the barrel, so no one liked you. Long story short, after a few push-ups and stuff, I get the aid bag, am ready for this event, went over my notes, am expecting gore and broken limbs, but no, this is where I truly got in over my head. The main casualty any medic will see, and you can ask every single one of them, is heat casualties. I was attached to a high-speed infantry unit. See, these mother trained for war, they blow up on the regular like Vikings and drink like a fish trying to drown itself. But one thing they just didn't do was drinking water. Not one person drank water, and because of this, guys would drop like flies. Let's fast forward a bit. The ruck is happening, and a few miles in, I finally get my first casualty. I hop out like Captain America with my little cool guy shades on and my helmet unbuckled, just thinking I looked cooler than I actually was. In AIT land, they went over heat casualties in about 5 minutes, and I was asleep in class most of the time. We slept 4 to 5 hours a night, and it was never continuous. So here I am, private dickhead, freaking out on the inside. They didn't teach me this, or did they, man? I'm soaking up. My NCO's screaming at me to hurry the up. They're talking about, you're gonna make the walls sweat when we get back, but I'm treating my casualty as best I can. Ice sheets, getting him in the shade, the whole shebang. I get him in the truck, then I get him but booty necked and starring 4. Naturally, I'm feeling good about myself. He's still alive, so we good, until the one question that me up more than anything: did you get a core temp? No, I did not. This process is simple, but in training you don't really get the full experience. See, this task requires you to spread their cheeks, maintain steady eye contact with the Eye of Sauron, holding back your own vomit, and inserting a thermometer in there. We called it biting the silver bullet. Everyone knew about the notoriety of the silver bullet, but I suddenly have this power in my hand. As I'm gliding it down the booty crack, I feel it give in. In my limited experience, I thought this was the booty hole. Wrong. It was not. It was rather what I call a phantom butthole. My NCOs looked at me like I was the dumbest to ever exist. There's only one hole, how do you miss? As this exchange is occurring, the casualty is just writhing back and forth in pain because I kind of forced it in there pretty hard. I ain't never seen a butthole outside of until then. I'm trying to convince him that I gotta go for round 2, and after a fruitful conversation, I try again. I finally shot expert. I get it in and kind of just left it there for a bit. I started to do paperwork, and after about 5 minutes, my NCO is yelling at me again. Why is the thermometer still in there? I sputter out a Sarge. I thought we had TO constantly re-asses. Yep, private dick face, you don't have to leave it in there. Needless to say, I did make the walls sweat. I had to write an apology letter for sodomizing this innocent victim, and I got better as a medic, but for sake, they never taught this in school. TLDR, young private sodomizes innocent victim. What to say to a family watching you code a patient for 15 minutes and pink frothy sputum is exploding out of their ET tube while you're doing compressions obligatory at it. Sometimes trauma ICU nurses get short and cynical at airport bars. Shout out to the homies in the comments who explained everything already. Story 23. I heard this story from a SLP. Always keep a clear exit. She was working with a stroke survivor, set her at the workspace, and walked around to the back of the table with her back against the wall and facing the door. Suddenly the little lady says, I know who you are. You're the lady who has been sleeping with my husband. Suddenly this lady has lunged across the table and is legitimately trying to kill the SLP. Luckily lots of other people came when she screamed code blue. She couldn't think of anything else at the moment. Story 24. I was never taught about sundown syndrome until I was working with the elderly in a hospital setting as a student nurse. I had the sweetest elderly patient in my care until about 4 p.m. that day. He suddenly became possessed. He started screaming and hallucinating and was not the man I had been providing care for earlier. I was so befuddled when the nurse I was shadowing told me he had sundowners and explained it to me. Story 25. RN here for me. The most surprising thing has been seeing firsthand how peaceful it is for a patient to be able to choose when and how they will die. I was present for the first medical-assisted suicide on my unit. The patient had his loved one surrounding him, and we all watched as he said goodbye, and shortly after took his last breath. In my area of nursing, patients get better and go home. I always viewed my work as a means to make people better. It has taken me a while to process his decision. It was beautiful and peaceful, and really made me look at nursing in a different way. I care for people to help them live, but for this man I was able to support him through death. Story 26. Number 1 most memorable cardiac massage for 10 straight minutes while a guy was bleeding to death from multiple gunshot wounds. Had to stick my fist up someone's left lung to locate the heart and to directly give him CPR, literally pumping this dude's heart so it can keep circulating blood. Felt like I was doing a fatality move in Mortal Kombat. It was surprisingly small and very squishy. They never teach you to expect the unexpected. I got floated to the ICU on a slow day. They immediately gave me a patient who was violently hemorrhaging out of his mouth while all the family was inside freaking out with me. He died an hour later. Had 2 different patients come in with eyes big kitchen knives deeply embedded in an eye socket. They were both awake and talking. Enema parties are a thing. Inflatable penis implant surgery is pretty shocking, but also amazing, opening up a tumor cyst to find fully grown teeth and hair inside of it. The day a patient exploded in surgery and it splattered the entire team and room with this brown fluid. There's an alarming number of nurses and doctors who don't know what they're doing. Eve learns so much more, but those are what I can immediately recall. Edit left lung. The heart is on your left side of the body, unless you have dextrocardia. Story 27. Book world and real-life nurse world is completely different. They'll play along. They never teach you that your psychotic dementia patient will try to hit you. They don't teach you how to react or don't to a patient or family member or physician yelling at you. Story 28. When my dad was a resident, he had to treat patients brought in from the Attica riot. So yeah, try sticking your finger up the guy who killed 3 people with a guard watching you. Story 29. Patients having and/or shooting up in the bathrooms. People coming in odd and then bouncing out the door as soon as they are conscious to come in odd again a day or 2 later. Then repeating the cycle every week or 2, but somehow never dying. Patients who fake symptoms to get admitted for attention or to get a day off work or get hopped up on goofballs or whatever thing they are after. Delirious old ladies telling me to get out of their living room or they will shoot me. Any kind of self-harm. Patients coming in next to dead because they've been neglected in the prison system. Story 30. If you have a patient in labor or in any painful procedure who wants to hold your hand, only let them hold 2 fingers. They can't squeeze them too hard and break the bones. They still get the comfort of human touch. I've had patients in labor pinch me, pull on my clothes, and squeeze my 2 fingers as hard as possible. Some are just panicked, but some seem to be angry and want to hurt someone. I calmly ask them to stop with the pinching or pulling on my clothes because that isn't helping them. These are often people who have refused an epidural because they are afraid of needles, and I understand that. I just am not going to be black and blue. I always teach the new nurses or students the two-finger trick. This reminds me, several years back at a couple in for delivery, asked what method of pain control they preferred. They looked at each other, giggled, then he said, "She bites me." I asked for clarification, and apparently during her first two deliveries, when the contraction pain became unbearable, she would take his hand and literally bite the out of his knuckle. They were both hip to this plan and oddly proud of it. Fast forward a couple hours and labor is getting well advanced. I look up from a vaginal exam in time to see her clamp her teeth on his calloused knuckle. She appeared to be biting with full pressure. He made a bit of face, but not a sound, and thus we ushered their youngest into the world. Contraction would start. She'd take a lung full of air and push to the count of 10 while biting the out of her man. It worked for them, so who am I to judge? But it made me somewhat uncomfortable. Story 31. They never teach nurses how to manage expressions in unexpected or poor situations. I personally have no trouble hiding everything, but watching people around me and the patients themselves tend to ask me what's wrong with that nurse doctor. Me being able to keep such a straight, relaxed face and expression helps everyone around normally. Being able to explain something bad without a panicked expression is an invaluable skill, which can definitely be learned taught, though nothing can prepare you for some situations. I can say I can't remain relaxed when I see a high-risk person's self remove a trachea tube. Story 32, obligatory. Not my story, but my grandmother's. My grandmother was a school nurse at an elementary school. They were letting the kids out for the day, and all of the kids were waiting outside for the day. One little boy's mom came to pick him up. As she was walking up to the building, she began to have a heart attack. My grandmother began CPR, sent someone to get the defibrillator, and told another teacher to call 911 as you were supposed to do. She passed before 911 arrived. I don't think twice her time in medical school could have prepared her for that. Story 33. My mother was a nurse who cared for elderly patients in a very rural part of England. Hey, race, a few her favorite stories. One was a lady who decided to help clean the windows. She used the food from her dinner as soap and napkins. There was a fun mess to clean up. Another was 3 gentlemen who spent the night calling out for their wives. One was named Edie, one was named Emma, the other was named Elspeth. She said that was one of the longest shifts ever. Finally, she said most of the elderly men were completely clueless when it came to ordering their dinners. They would always say something along the lines of, "That's my wife's job." She used to just order them the basic meat and 2 veg option and rarely got complaints. Whatever your granddad would like usually was the safest. Bet my grandfather was a farmer. Story 34. When your patient has the size and shape of a football stuck in there, and you have to use your finger to delicately scoop it out when the doctor comes along and tells your patient they're dying of cancer, then walks away and leaves you to pick up the pieces. When your patient is 90 years old, has dementia, diabetes, cancer, and comes to hospital with pneumonia, they are 30 kilograms soaking wet. Nothing but a bag of bones who doesn't recognize themselves in the mirror. Yet their family insists they are for CPR. Story 35. As a sonographer, I have to keep a poker face a lot of times when I'm seeing something very alarming or sad on the screen. Luckily, most people have no idea what I'm looking at, so that's a plus. I'm not allowed to give any results to patients. Doctors deliver the bad news, so I have to stay neutral. It's really hard. Story 36. Had a 60-something-year-old female patient show up for a same-day appointment to establish care from out of state. No medical records. Denies any major medical history or medications. Never smoked, drank, or did drugs. Midway through the exam, she starts telling me that she is seeing evil lines all over her house. States she is unable to cross these lines, and thus unable to access parts of her house, e.g., her bathroom. Hears voices coming through the walls, feels shadows at night, are demons. Thinks the neighbors are hexing her all the time. Starts talking about the occult and Freemasons ruling the world. Suddenly stops mid-sentence, stares at me without blinking, and wants to know if I could perform an exorcism. Missed that section in medical school. Story 37. Harassed by an elderly patient. The guy is 80 and frail. Was I grossed out? Yes. Was I threatened? No. But they don't teach us how to respond to impotent harassment from hospitalized patients. Do I get a new doctor for him? What if that doctor is a woman too? Should I put up with it? I treat rude abusive every day. Why would this be any different? Still trying to figure out what I should do. So many things. I'd say the chief thing we're not prepared for is just how cruel, bullying, and inhumane our own colleagues can be, not just to each other, but to patients and families. We are absolutely not taught how to handle the stress of our jobs. not given tools to deal with that one raging coworker who just doesn't pull their weight, and not taught how to de-escalate a family that's just been antagonized by an overstressed, burnout nurse, physician, aide tech, etc. I've worked as an EMT, a tech, and now as an RN, and I could say without fail that more stress in my job comes from baloney from coworkers than anything else. Maybe I work in the wrong hospital. Story 38. As a student nurse, I observed a cesarean DT preeclampsia. Lady is awake with epidural in place, and a screen in front of her. All went well, nothing dramatic there, uterus sewn back up, and I was starting to relax and look around when the surgeon asked a med student at the foot of the bed to step aside. He then reached in and pumped the uterus twice and hard, forcing the remaining after products out her vagina fast. The wall wasn't that far from the foot of the bed, and that student had definitely been in the line of fire. The point didn't notice, and the husband didn't seem to. The med student and I looked at each other. She just said, "I guess that's logical enough to know how standard that is. Haven't been back to, but I sure wasn't ready for it." Story 39. That you will get yelled at by a doctor, patient, fellow nurse, charge nurse, etc. for something that was not your fault. The first time I was yelled at was about a not calling a morning lab that wasn't a critical result. It was hard not to take it personally, and I didn't need a minute to recover. Since then, I take criticism better, but sometimes we all yell, especially in high-stress situations, and sometimes people are dicks. Story 40. Long story short, resident at nursing home had hemorrhoids. They were noted to be bleeding at the beginning of my shift, stated to my NAS, to notify me when they change her, so I can scale the amount. Orders for the medicine was sent in, nothing from a NAS. Resident was fine when I check on her, pass on info to next shift, and go home. Get called into the office next day to be yelled at about it. I followed protocol and charted accurately. Medicine is not available at this time, none in backup. So they then, and me, "Why didn't I put an ice cube in her?" An ice cube, I exclaim. Yes, they said, "Didn't you learn that in school?" No. We have to have orders from a doctor for a cold pack, let alone pillet an ice cube where the sun doesn't shine. Story 41. How to do taxes, do networking, or be an adult in general. Maybe in the US it's different, but lots of doctors here are basically overgrown children because they go to med school straight out of college at 21 and are fairly well off that they didn't really need to have regular employment beforehand. Story 42. Paramedic here. They don't give you a class on telling families bad news, such as in the death of a loved one. I found over the years if you come out and say so, and so is dead, literally using the word dead, people understand it better. It's brutally honest and not beating around the bush. I don't use passed on or in a better place. Am not a religious person or even remotely spiritual, so I don't say religious. It's not place to do that. I just give them the facts. Story 43. Doc here. Infant 2 months came in unresponsive. Despite our best efforts, there was nothing we could do. In that situation, we have to assume the worst despite the mother's story, and the baby must be examined and sometimes scanned to check for evidence of abuse. Had to wing it as I took a dead infant from the hysterical and extremely upset mother shouting at me in a language I didn't understand. To this day, I will never forget those screams of pain. Parents, please don't let your infant sleep in a bed with you. Story 44. Had a patient with horrendous teeth meth user. Couple of teeth fell out during intubation, so they sent him up with them in a denture cup. That was a real awkward conversation. When he woke up, anytime there's something up the butt, that time a 100-year-old grandma broke her hip falling out of bed, but not her bed. On a more serious note, the "your loved one is dead" phone calls. This is usually done by the doctors, as I feel it should be, but sometimes nurses do it. Story 45. Not a nurse or doctor, but I'll never forget the comment my labor and delivery nurse made. I had been laboring in the tub of the hospital, but wasn't supposed to actually birth in it. When all of a sudden I could feel the baby coming, my husband pulled the emergency cord and the nurses rushed in. Through the haze of baby crowning pain, I heard a panicked nurse say, "I don't know what to do. What do we do?" I distinctly remember laughing to myself and heard my midwife's calm voice say, "It's okay, I've got it," as she moved past the nurse and took over. Story 46. My daughter had a mucus cyst in her lip. Hideous thing. Gigantic and throbbing and horribly embarrassing for her. When it didn't go away after a week or so, she went to her doctor, who happened to have a posse of residents under him that week. They all came in to pike it and learn about it. She just got it removed today, and there were 6 extra doctors and they're watching it all go down. It's basically a blocked saliva gland full of lip snot. It was very exciting for everyone except her. Poor girl. Story 47. Some people talk while under anesthesia. Some people even scream. I used to go home in tears, especially after very vocal patients. The only thing that helped was when patients would wake up and tell us thank you so much. That went so fast. Post-op checks a week later where I could see the patients were still okay helped too. I remember asking the doctor over and over when I first started, "Are you sure they're under? Are you sure they're numb?" Now, after a few years' experience, I understand how much local anesthetic he used, and that patients were likely numb for a few hours post-treatment. Dental assistant who worked for an oral surgeon. Story 48, if you want to take away anything from this thread, is take a CPR class, learn basic first aid. Google and learn about living will, advanced directive, and DNR. Talk now to your loved ones about what you want to happen when you're no longer about to care for yourself, kept alive via machines able to make decisions. And please know that people in the medical community are overworked, underpaid, miss their families, probably have to pee, and are here for you and your family. Please take time to research and vote on bills affect healthcare, EMS, hospitals, and first responders. They will affect you too.